Welcome, everyone, to our first community conversation addressing Dartmouth's planning, response, and operations in the time of COVID-19. I'm Joe Helble. I'm the Dartmouth College Provost, and I'm joining you this afternoon from a nearly empty campus, sitting in a very quiet STAR instructional studio. It's great to have a chance to connect, although I will say personally, it's not nearly the same. Looking around at the campus today and seeing it nearly empty of students, empty of faculty and staff on a beautiful springtime day, it certainly doesn't feel quite right to me, and I know it doesn't feel quite right to any of us. The campus is certainly different. In our conversation this afternoon, I'm going to be joined by Justin Anderson, who is our Vice President for Communications, who is sitting in another studio on campus, and our COVID-19 Task Force co-chairs, Josh Keniston, who is the interim VP for Campus Services, joining us from his home, and Lisa Adams, who is a professor of medicine at Geisel, an MD, our Associate Dean for Global Health in the Geisel School of Medicine, a professor of medicine, and a specialist in the care and treatment of infectious TB. And Lisa is also joining us from her home in Norwich. Our format that each week for these sessions is going to be a brief update, perhaps 10 or 15 minutes, where I will walk through some of the decisions that we're in the midst of making and talk about planning for the next set of decisions that will affect operations and academic planning and academic operations on the campus in the weeks and months ahead. We'll then take live question and answer that'll be moderated by Justin Anderson, and then turn to have a brief conversation with campus leaders, in this case today, the task force co-chairs, Josh Keniston and Lisa Adams, and then we will turn to you, the audience, for any questions you'd like to put specifically to our guests before I wrap up briefly with a few words at the end. Our goal in these campus communications, these campus conversations, is to amplify the messages that the task force co-chairs, that President Phil Hanlon and I have been putting out in our written communications, and again, to give you an update on what's happening now on campus and at Dartmouth, and truly to do our best to answer the questions that we know are on everyone's mind. Now, the decision that we made most immediately that I trust nearly everyone has seen and is familiar with is a decision we announced a week ago Monday around summer term, the transition to a full summer term of remote learning. What I'd like to do today is not go through that decision per se, because I'm trusting that you're all familiar with the details, but speak a little bit about the process that led us to that decision to help give everyone a sense of how we are beginning to think about the process leading to decisions around fall term. When we made the announcement of the summer term decision last Monday, I can tell you that my email inbox, President Hanlon's email inbox, Dean Lively's email inbox, the task force email inbox, and every other senior leader immediately began receiving questions appropriately about what's next. What's the timeline for decisions that impact other operations this summer? What's the timeline for decisions about the fall term? What kinds of decisions are we contemplating for the fall term? And I anticipate today that many of you will have questions there. But as I said, let me start with summer and just take a few minutes to walk through the thinking that guided our decision making. Now, from the beginning, as we've approached our decisions related to campus operations and Dartmouth operations associated with the COVID-19 pandemic, we have said, and I have said as clearly as I can, that our absolute first priority is the health, safety, and well-being of the community. This means the health, safety, and well-being of our student community. It means the health, safety, and well-being of our campus faculty and staff community. And it also means the health, safety, and well-being of the broader Upper Valley community that interacts with Dartmouth so directly on a daily basis. We've also said, and I've also said, that paramount in this is ensuring the educational continuity of our students. This is the educational continuity of students in the classroom. This is the educational continuity of students pursuing independent research projects. This is the educational continuity of undergraduate and graduate students alike across the entirety of the Dartmouth campus. And our goal and my goal in all of this is to be in a position where, guided by the task force, we are able to make, and I am able to announce, operational decisions as early as we can to provide certainty and guidance in the community, but to provide them as late as possible to be as well informed as we can in making those decisions. And I recognize that those principles may seem inherently contradictory, But that's part of the challenge and so much of what we're wrestling with in planning our response to COVID-19. We recognize that so many members of our community are looking for certainty so they can be able to plan. But we also recognize that the parameters in federal and state guidance are changing so rapidly that we don't want to make decisions that have tremendous operational impact and tremendous impact on our workers on campus, our students, our faculty and staff, and the larger Upper Valley community any sooner than we absolutely have to. So what parameters are we thinking about as we make decisions related to COVID-19? Well, first and foremost, we need to look at the rate of progression of the disease in our local community, in the states of New Hampshire and Vermont, nationally and also internationally. Why do we need to be thinking about the progression of the disease beyond just the Upper Valley? Well, that's because Dartmouth draws a national and international community of scholars and students to our campus. And so it's not just progression of the disease in the surrounding Upper Valley environment that's relevant, but it truly is the rate of infection and the rate of containment of the disease across the entire country, across the entire world. We have to ask ourselves whether we have adequate supplies of personal protective equipment and adequate ability to test people who are infected or potentially infected or exposed before making a decision that we can bring large numbers of students, faculty, and staff back to campus. We ask ourselves whether our ability to make operational decisions that would begin to reopen the campus need to rely on unrealistic expectations of our students and our community. You can imagine if we said we can open the campus to students, but it can be one student per building, you need to be fully gowned at all times, and you need to effectively be locked in your room and not interact with another human being. That's certainly not the Dartmouth experience we want to promote, and that's not a realistic expectation to impose upon our students. We need to ask whether there is still a need and federal and state guidance requiring self-quarantine of all individuals returning to our campus. And we take a look at what decisions our peers are making. And here I have to say it's been extraordinarily how openly our Ivy League peers and other educational peers and we have been sharing information and planning together. We are all in this together as we try and figure out the best path forward to bring students, bring staff, bring faculty, and bring research activity and educational activity back to our campuses. Decisions our peers are making are informative, but they are not determinative because each institution, and certainly Dartmouth in our rural environment in northern New Hampshire, has some unique characteristics that have to be considered as part of the process. And finally, let me say that the financial implications of the COVID-19 pandemic, the economic downturn associated with all of the self-isolation, self-quarantine, and self-restrictions and cessation of travel and restriction of economic activity have had on higher ed broadly and on Dartmouth have to be part of our calculus. We've said quite openly over the past few weeks that our loss in the fourth quarter alone of fiscal year 2020, the fiscal year that ends June 30th, was over $50 million operationally, and that's not counting additional investment losses in our working capital pool. We anticipate and project that there will be additional losses of $7 million over the course of the summer. With that kind of revenue loss, that kind of loss affecting all of higher education, we have to think about not just our ability to sustain that level of loss, but we have to think about the impact on our community and on jobs as we begin to make decisions for opening or reopening down the road. So when could we reopen residentially? What are the factors that we consider in making a decision whether or not summer, or for that matter, whether or not fall would be an appropriate time to begin bringing students back to campus? Well, here too, we're guided by advice from federal and state authorities. We're guided by advice from academic experts, including our own. We're guided by advice of business groups that are providing recommendations to their communities as to when businesses can be reasonably reopened. And some of the best guidance we've seen actually came over a month ago from the American Enterprise Institute, where they laid out pretty clear parameters that govern when an institution can begin to think about reopening for business, or in our case, reopening for residential education. And those are a steady reduction in the caseload in the relevant geographic area. And they recommend a steady reduction in cases over a period of 14 days. The presence of adequate treatment capacity to treat those who are infected and affected in your community. the presence of adequate testing capacity, and the presence of adequate monitoring, contact tracing, quarantine, and isolation capabilities. And when you look at all of that together and you think about where we are today as we look forward to the start of summer term in a little less than 2 months' time and ask, do we have these? The answer for most of those is no. We have been pleasantly surprised, perhaps due to the effectiveness of some of the social distancing measures in the Upper Valley, that our local medical system, the Dartmouth Hitchcock Medical Center, has seen far fewer cases of COVID-19 than they had anticipated. So we do, at this moment in time, have adequate treatment capacity in the Upper Valley healthcare system. But on all of the other measures, including effective testing capacity, availability of PPE, monitoring and contact tracing capacity, we are not where we need to be to consider a significant reopening residentially of our campus. So the decision we announced was to be remote only for the summer, with our coursework to be graded, as Dean Elizabeth Smith and I had announced in mid-March when we indicated that the spring term would be a term of credit, no credit grading only. We announced for our sophomores who will not be able to have a residential sophomore summer experience this year, that if they wish, they could choose instead to be in residence in the summer of 2021 to experience that summer in Hanover as part of their education. We also announced the cancellation of on-campus Tuck Bridge program, the remote start of the Tuck and Geisel Master in Healthcare Delivery Science programs, and the cancellation of all on-campus athletic camps, performing arts events, and the Hanover Country Club for the summer. Basically, physically, at this point in time, we have announced that the campus is remaining closed for educational activity and for residential activity over the course of the summer. So with those decisions, what comes next? The first thing that I know is on the minds of many of our undergraduate students is the logistical question. Now that summer term is not happening as a residential term, how will we return your belongings to you that you had to leave behind when you went home for spring break? That's something that the task force is working on, and I'm going to turn to Josh Keniston and Lisa Adams in a few minutes to provide some insight and answers to that question. What about grading? What does a graded summer experience look like? Well, we will return to graded and evaluated coursework, but our faculty committees are working through questions around the specific parameters, whether or not we might, for example, expand the NRO option. And I anticipate having an announcement out to campus with the details on that within the next 2 weeks. And what about fall term itself? As we think about fall term, the immediate and obvious options that may come to mind for everyone are the two extremes. Either fall term is another term that is fully remote learning, continuing the practice of spring term and summer term, or fall term is a full residential term with everyone back on campus, life as usual, business as usual. As I sit here over these past few months and talk with epidemiologists, talk with physicians, talk with our scientists, talk with public health officials, and talk with our colleagues on the task force, it's becoming increasingly clear to me that the opportunity for a flip the lights switch, return to normal, business as usual operation is, while I won't say impossible, highly unlikely for us or any of our other peer higher educational institutions. So where does that leave us? It leaves us considering and contemplating things that I would call hybrid operation, where some fraction of our students would come back to campus, some fraction of our students would continue in residential learning. But let me say clearly and unequivocally that in all of these options, Dartmouth will be open as an educational institution this fall. We are not in any way contemplating cancellation of the fall academic quarter. We are working diligently right now with the task force to figure out how we can most effectively structure that fall term and how we can bring safely and securely the maximum number of students back to campus for a residential experience this fall. How are we going to get there as we think about the summer and the months ahead? Well, first and slowly, as I said to a student reporter from the D who interviewed me the other day, we are going to begin focusing this summer in the very near term on the slow reopening of our research facilities, bringing graduate students and postdoctoral scholars and some faculty and staff back to campus in a very staged, managed, and measured function. We know that through that experience over the course of the summer, we will learn some of the steps that will be essential to protect community health when we bring larger numbers of undergraduate students and graduate students back to campus in the fall. We have just put in place this week, through collaboration with our partners at Dartmouth Hitchcock Medical Center, a health working group that is going to help us think through exactly how we can manage the population health, manage student, faculty, and staff on-campus health through this fall by figuring out how to effectively test and frequently test the community for presence of the disease, how to procure adequate personal protective equipment, what social distancing guidelines we can put in place, how we can effectively manage contact tracing when someone is believed to or expected to have developed symptoms of COVID-19, what kind of monitoring can we have in place to monitor and manage community health, and what kind of quarantine and isolation facilities will we have. Our task force will focus on how we accomplish these things, and an academic working group composed of deans and associate deans will be working with me to figure out how we structure the curriculum, recognizing that it's likely to be hybrid with some students on campus and some students learning remotely, to most effectively meet the educational needs of our students. There's a lot of complexity embedded in all of this. And so a question I'm sure is on everyone's mind is, when will we be able to make a decision and when will we announce? We anticipate announcing our plan for the fall term by the end of June. June 29th is the operational date we have given ourselves to announce that decision. Our fall course selection process, because we are not going to make an announcement on the structure of fall term until June 29th, is therefore going to be postponed. Rather than having students register for courses in May, we are going to postpone the listing and timetables of courses to mid-July, and registration for fall term classes will happen over the course of July. But first, before we get to those points, we need to make and announce operational decisions around belongings, around grading, around June virtual commencement plans, which I anticipate are releasing in the next few weeks, and around fall off-campus programs and travel. And embedded in all of this, we also need to be thinking about steps that we will need to take in the coming months to address the extraordinary financial and budgetary challenge that COVID-19 has imposed upon this campus. But let me simply say in closing that guiding us in all of these steps is going to be adherence to the first principles that I outlined at the very beginning. It is an absolute focus on the health and safety of our community, our students and our faculty and staff, and the local members of the Upper Valley community. It is on focusing on the educational continuity, research, and training of our students, undergraduate and graduate alike. And let me say, we are doing that with a community that continues to inspire me. It has been an extraordinarily resilient and supportive community. I had meetings with 2 faculty committees last week, and the stories I was hearing from the faculty committees and from department chairs in a meeting with all the arts and sciences and Thayer department chairs just 2 days ago this week, about how the faculty are engaging with students, how the students are engaging with the faculty, and how everyone is embracing this shift to remote learning. It's been truly extraordinary. And let me finally say, before I turn to Justin to take your questions, that some of you who know me know that I'm quietly competitive, and not that I like to see us in a position that beats the rest of the Ivy League, but I will point out that Dartmouth, because of the nature of our academic calendar, has somewhat of an advantage here. All of our peer institutions had to make decisions to go to remote learning in the middle of an academic semester. We made the decision to do so at the start of the spring term, the spring quarter. And so we will have, by the end of this term, a full quarter of academic experience teaching and learning remotely under our belts. We will get a second term of remote learning completely under our belts by the end of the summer. So when September 1st arrives, the scorecard will say that Dartmouth has had 2 complete terms of learning how to effectively engage with students, challenge our students, provide assignments, grade assignments, and work with our students, mentor and advise our students by remote learning, where many of our peers across the country are just about to start their very first semester of full online learning. We won't keep this to ourselves. The academic community, as I said, has been extraordinary, and we will be sharing with them lessons that we have learned, just as they've been sharing with us lessons that they've been learned along the way. So let me stop there. Thank you all for your engagement and for listening. And we'll turn to Justin Anderson, who will moderate some of the questions that I can see that you've been sending in. Thank you. Justin?
Thanks a lot, Joe. It's nice to be with you, although it's only virtual. It's nice to see you. So a lot of questions have come in over the course of the last 10 minutes. You just addressed what may happen in the fall. Fair number of questions about the summer. Mm-hmm. Two questions in particular. I'm seeing a lot of questions about the return of staff to campus. One question: when will staff return to campus? And then how will you determine which departments or areas open first?
Yeah, that's a really good question. And one could ask, in fact, the same questions about research laboratories and how we will determine which ones will open first and what the schedule will be. So first and foremost, we need to be responsive to the guidance and, in fact, executive orders of the governors of New Hampshire and Vermont. And so we are waiting for their indication that restrictions can be relaxed and we can begin to contemplate a lessening of the work from home expectation or requirement. The task force has working groups that are looking at which functions we can and should first bring back to campus. Initially, I anticipate those will be functions that are either struggling to get their work done effectively through remote learning or those that are supporting the on-campus research enterprise as the first place to start. That's something that is going to be a work in progress over the course of the summer. And as I said, our guidance has to be driven by state guidelines and, in fact, executive order requirements in the near term. When will it happen? It's a question I'm asked often. This is a guess. I will say I am hopeful that by late June or the beginning of July, we will begin to be able to bring people back to campus. It might be sooner, it might be later. That's simply my best guess sitting where I am today.
Thanks, Joe. This next one, I'm assuming, is from, well, it could be from a student or even a student considering coming to Dartmouth. When will a decision be made about first-year trips, FICEP orientation?
As you might imagine, as we think about the academic program for the fall and we think about the schedule for the fall, there are groups who are looking very actively at the best ways to engage with incoming first-year students. What does that mean for FICEP? What does that mean for first-year trips? I think we will be in a position where we can make decisions on first-year trips sooner than the June 29th deadline that we have announced for anticipating announcing the structure of the academic fall term. How much sooner, I don't know. I don't anticipate that we'll be in a position to give an answer to that over the next couple of weeks. Our first order of business is to look at international travel programs for the fall, and I know that there is a working group in the task force that is committed to making recommendations around fall off-campus programs, language study and foreign study programs by mid to late May. I would imagine that we will be making decisions around FICEP, other residential programs like FICEP, first-year orientation, first-year trips in the same time frame. So mid-May to late May, possibly early June.
Thanks. This question just came in about the endowment. Is there a possibility that trustees could find a middle ground between the fear of depleting our endowment and using this amazing rainy day fund for this extraordinary rainy day?
It's in fairness, Justin, that's a good point because this is an extraordinarily rainy day. It's a rainy day in ways that no one ever anticipated. Higher ed has experienced economic crisis before, but it's the combination of the depth and the rapidity of the transition in operations and the transition financially that is something that we truly have not seen as a community of educators ever in our history. So how do we think about the endowment in this context? And this is a question that friends and colleagues in town and on campus have asked me by email frequently because I'm not seeing too many people face to face, but frequently are asking me this question. The endowment, I think you used the term rainy day fund. We have to be very careful in acknowledging that the endowment, in fact, is not a rainy day fund. It is funding that was provided to the institution over generations with very specific purposes in mind. Most of the uses of the endowment are restricted by SOU, Statement of Understanding. They are, in fact, essentially legally restricted, where a donor gives us money very generously to support a specific building, a specific program, a specific faculty member's faculty line. The funds that come in through earnings on the endowment are used and can be used to support that activity only. They're not fungible and they can't be used to address institution-wide operational funding deficits. A thing we need to remember in all of this is that we are in fact using the endowment to support the operations of the institution. Dartmouth's fiscal year 2020 budget is roughly $1 billion, and the endowment earnings on the endowment support over $250 million of those operations. So why not draw more? And there's a fundamental principle that you'll hear the president, you'll hear me, you'll hear the board, you'll hear many of us speak about when we speak about the endowment and the use of the endowment. And that's one of intergenerational equity. Dartmouth is the institution that Dartmouth is today because of the generous philanthropy of alumni and friends in generations past that was stewarded and protected and preserved, that enabled us to draw operating funds, that enable us to have faculty that we have on campus today, that enable us to have jobs that we have on campus today, that enable us to have financial aid for students that we have on campus today. If those decisions had not been made to preserve the endowment, even in past moments of financial crisis, we would have fewer students, we would have fewer jobs, we would have less financial aid available, we would have fewer faculty. And so this principle of intergenerational equity doesn't just apply in the past. We have to think about carrying it forward for generations to come, to preserve the continuity of operations and to preserve the core of the Dartmouth academic and educational mission. And let me just end, because this is something I think about a lot, by perhaps not to put too fine of a point on it, but I'm an engineer and I like to think about the quantitative aspect. I think about the numbers. We're facing roughly $100 million combined operating loss if you include the working capital portion for spring term and summer term alone. Why not take $100 million out of the endowment if you could and use it to fill that gap? That $100 million, once you draw upon it, is gone forever. It's not earning interest. The principal isn't growing going forward. That $100 million would generate $5 million in annual operating budget support that our budgets count upon. Take that away, $5 million, that is 100 full scholarships for students that we would no longer be able to fund. It is 140 staff and faculty positions. And so the implications are huge to doing something that may seem like a simple step, drawing from the endowment now to address an immediate financial challenge. And so for that reason, through generations, the trustees and the administrative leadership have always used the endowment as a resource of last resort because of the tremendous and long-lasting impacts it has on the future operations of the institution.
Thanks, Joe. And I guess let's stay on the issue of how we can fund our operation. There's a question about the use of the federal stimulus money, part of the CARES Act. The CARES Act, as you know, is a $2.2 trillion federal bill, and of that, 14.5 billion was set aside for allocation to institutions of higher education. And as such, Dartmouth has been allocated a certain amount of that money. So the question is Dartmouth going to take advantage of the CARES Act to use for funding for undergraduate grants?
So the CARES Act, as you know, Justin, and as our listeners may know, sets aside funding for each institution of higher learning in this country through a formula that looks at student need. It is support that is designed to help address the economic hardship faced by institutions and by the most needy students on campus. Dartmouth's allocation through formula has been announced at $3.4 million of support. We have not yet applied to accept that funding, but if we do, we are committed to applying 100% of that funding to support students and student needs. Now, as you might know, those of you who have been paying attention to the press on this know that there has been some pressure applied on some institutions to consider turning down the funding because of the size of the endowment or because of the scope of the university. But if you look at those institutions, and particularly if you look at Dartmouth, there is no question that there are students in need. There is no question that there are students and families whose financial need will be increasing significantly because of this economic hardship. So we are thinking very carefully about the value of accepting those funds to support our students at this particular moment in time. And as a matter of principle, I think one needs to keep in mind our students absolutely need this funding to help support what Dartmouth can provide. And we also have to recognize that in a moment where we're asking all of the Dartmouth campus community, through our salary freeze for faculty and staff, through the hiring freeze, through the request that everyone reduce their fourth quarter non-compensation expenses, we're asking everyone to make financial sacrifice. I think it's incumbent upon us to look to every source of support for the Dartmouth community and for our students. And so we are thinking very carefully about proceeding with filing an application to seek this funding.
Thanks, Joe. So we've been receiving questions now for over a half an hour, and I'll tell you that the two most popular questions are, number one, when and how can I get my belongings, which I know you said that Josh would address. So we'll get to that. But the other most popular question is about layoffs and furloughs, and when decisions may be made about that or announcements made about whether or not that's happening.
Right. Yeah, that's another really important question for so many members of the Dartmouth community. And there I can say we are committed to being as transparent as we can about any decision we need to make and to announce any decision as soon as we possibly can. I think you know that when Dartmouth made the decision to suspend residential operations for spring term in the middle of March, we made the commitment to continue to pay at full salary all members of the staff for 3.5 months through the end of June, in the hopes that the economic hardship that we were facing in the fourth quarter of this fiscal year would lessen, and in the hopes that we would be in a position to begin returning to residential operation over the course of the summer. That now is not happening, and we are thinking very carefully about what a fall term operation, a hybrid operation, would look like. Our needs to support students on campus are going to be driven significantly by the protocols we put in place to help preserve and protect the health of the community. Faculty, staff, and students are going to be driven substantially by the number of students who are on campus and how our residential buildings are being used. So we can't answer the question about any potential furloughs or layoffs until we have better insight into what the fall term is going to look like. I said earlier, we're not going to announce a fall term decision, an academic decision, until the end of June, but we will not wait that long to make any announcements about potential furloughs or layoffs that might begin as early as July 1st. And so we are committed to making decisions on those to the extent that we can by the beginning of June. And we will be open and transparent with the community as we go through that process. And it's something that I'm happy to continue to comment on in these weekly forums, because I know how important it is to so many members of our community.
Thanks, Joe. We have time for one more question before we get to Josh and Lisa. This is another one that has been popping up a number of times. Is the COVID-19 task force doing anything to consider student input and perspectives?
They are. We do not, other than on one committee, there is a working group that has been working as part of the task force to help us develop a structure for a potential virtual celebration and commencement ceremony in June, not to replace the physical commencement, but to give us a marker in time of this celebratory moment in the conferral of degrees as we anticipate then a full physical and normal commencement ceremony in 2021. There have been students contributing very directly to that committee. In other parts of the working group, there are not and have not been students on the task force or on the working groups, because the individuals on the working group are individuals who are charged with making major financial and operational decisions, controlling operational units, managing facilities, overseeing academic program, directing travel programs for the campus. We have, however, sought and received significant student input, significant student perspective that has helped inform some of the decisions that we made. There was a tremendous amount of student input that was sought and considered as we made the decision to have spring term be a credit, no credit grading term. There is student input being provided in a very structured and helpful way through the student assembly, a long series of questions that they provided to us in leadership in late March, and a second series of questions that I just received this morning that we will be responding to by early next week that help provide the student perspective and ask for student guidance. And finally, I know that Dean Catherine Lively, the Dean of the College, and her team in Student Affairs have been hearing from students regularly and have also been reaching out to students proactively to seek student input on things like processes for getting belongings back that have been an important consideration as we develop plans for those steps that are happening next. So there is a very important student voice in all of the processes we're undertaking, even absent having students, for the reasons I articulated, being explicitly appointed to this task force that's comprised of institutional divisional leaders. Great.
Well, thanks, Joe. And speaking of the task force, I think you're about to speak to the chairs of the task force.
Yes. So thank you, Justin, and thanks to everyone who sent those questions in, and please keep them coming. We will be doing this again on a regular basis, and I look forward to taking more of your questions next Wednesday at the same time. I'd like to turn now to Josh Keniston and Lisa Adams, the co-chairs of the COVID-19 task force, whom I interviewed or when I introduced at the beginning. I'm going to ask each of them just a few questions to help give you a sense of the work that they're doing, and then we're going to turn it over to you with questions moderated by Justin again that you can put directly to the task force. So first, I'd like to ask Josh and then Lisa to very quickly and succinctly give us a high-level structure of the task force from your perspective and talk about your specific role on the task force and your specific and current focus, since one of you comes very much from the operational side of managing the campus and the other one is an infectious disease specialist from the Geisel School of Medicine. Josh, why don't we start with you?
Sure. Thanks, Joe. Good to see you, and good to see you too, Lisa. So the task force is, Joe, we report directly to you, but really our job is to coordinate across the institution. I've been at Dartmouth just about 3 years, and never have I had the chance in such a short period of time to get to meet so many individuals. And that's really been kind of a hidden perk here. But we have 24 individuals from all of the professional schools, from some of the key divisions that are represented on the task force, and then about a dozen sub-working groups, things like travel support, business continuity, research continuity, a variety of areas, all working on how do we think about fall, and how do we track towards that. So my role is really, as the interim VP of campus services, is to come at this from an operational perspective. How do we think about getting the campus ready and responding?
Thanks. And Lisa, as a physician scientist, tell us about your role on the task force.
Sure. Thanks again for having us participate. So my role on the task force has really been to focus on the medical and public health aspects and the epidemiological data. I and my health and epidemiology colleagues are the ones who are closely examining that COVID-19 data for New Hampshire, for Vermont, for the US, and really across the globe. We are closely following the trajectories and slopes of the disease curves and looking at the various models that are designed to help us project what we can expect to see in the near future and long-term future. We're also, of course, dealing with the uncertainty in the data and the model projections and doing our best to examine all available resources and sources and to make the most sound interpretations of the data. You also mentioned that we're working very closely with Dartmouth Hitchcock Medical Center colleagues and partners at the New Hampshire State Health Department to align our guidance recommendations and plans for things like testing, access and capability, and care delivery for our community. And you also mentioned, and I think it's worth highlighting, that our broader task force goal, and what I take very personally and seriously, is really to do our best to safeguard the health and well-being of those in our community. So I see my role as making sure that we have the best available data and information to make sure that all of our recommendations and the decisions by senior leadership are based on the best available scientific and public health evidence.
Thanks. And how often are you in touch with the state epidemiologist or your colleagues at DH? I remember certainly in the early days of this, it seemed as if you were on at least one call, if not more, daily.
Yeah, it certainly was quite frequent in the early days, especially as things were, practices were getting implemented and changes were coming fast and furious at us and information, and we were having our first cases and figuring out how we were going to be dealing with those in the community. So now it has sort of tapered off to a steady state of almost daily with Dartmouth Hitchcock colleagues and a little bit less frequently now with the health department, but we are, we know they're good colleagues of mine from the infectious disease section who are involved in both state and Dartmouth Hitchcock leadership. So we're always only a phone call away.
Oh, great. So it's pretty clear there's still very frequent collaboration and connection. So one of the questions I've been asked, less so now in the later stages of our managing the disease here in the Upper Valley community, but certainly frequently in the beginning, was how are we faring? How many cases are there? Where are they? And how are we accommodating them on campus? I know some of this is information that needs to be protected, but what can you tell us about the numbers and how we're managing it on campus?
So what I can share is that to date, we've had just under 10 students with confirmed COVID-19 in the Upper Valley. We're also aware that there have been a few cases amongst our employees, but we know that there's community transmission in both New Hampshire and Vermont, so this really does not come as a surprise. We've also heard from students who have moved outside of the Upper Valley that they or a family member have been diagnosed with COVID-19, and our college health services providers have offered telehealth support to those students, and I think are available to all students who have questions and concerns about COVID-19. Now, regarding the self-quarantine and self-isolation piece, we have identified spaces on campus that we have cleared and cleaned to allow us to isolate up to 35 students who are ill, but not ill enough to require hospitalization. And we've also cleared and cleaned rooms for a similar number of students who have been identified as contacts to individuals with COVID-19 and need to self-quarantine for 14 days. So these are spaces that meet our infection control criteria of having a single room, a private bathroom, and then of course we've arranged for meal delivery for students in those spaces. Now, fortunately, we've never had more than a dozen students in either our isolation or quarantine spaces at any one time. But we really feel that this has served as a good practice run for us to know what will be needed practically and logistically, and how will we manage when we are able to welcome more students back to campus.
Thanks, Lisa. And I have to say, one of the things I got to see firsthand a few weeks ago was the great lengths that the dining services staff have gone to take care of the students who are in isolation and quarantine. It's really extraordinary to see the steps they've taken, both to prepare meals for students who are still here on campus, but also deliver food to those who are in isolation and quarantine. So Josh, let me turn to you now with the question perhaps that's on everyone's minds, at least all of the undergraduate students, and that is the belongings that were left behind on campus. And so I know the task force is working on this. I know that you promised me I'll be seeing the final plan very soon. What can you tell us about where that stands and when we'll be able to announce to campus the plan for returning student belongings?
Yeah, that's a good one, Joe. And I'm not going to have the complete plan today, but I'll update you on where we are. We're working hard, and we're probably about 2 weeks if not sooner, away from being able to roll that out. And Dean Lively will follow up with those details as soon as they're ready. We'd all hope this was not going to go on as long as it has. And so we are digging in and looking at what the options are. It's complex. We have about 3,200 students' belongings that we need to deal with. And it's things like, how do you get, thousands of boxes to box things up that we're looking at. We're looking at options to ship some of the stuff that needs to get there, in a quicker time frame. So we're looking at all of that information right now and putting together a plan. And we'll roll that out, as I said, within the next 2 weeks. And it's going to take the course of the summer to fully implement it. But by the end of the summer, we'll be able to have belongings back to most of the students.
Thanks. That's encouraging. I'm sure for many, it's not as soon as they would like. We know everyone would have loved to have had their belongings back the first week after we needed to close in the spring. But I also have to say that I've been impressed and appreciative of how the vast majority of students and their families have recognized that this is a public health crisis like none we've ever seen, and have given us, the campus community and leadership, the flexibility to work through the plans. And I'm really pleased to see that we're close to being able to roll out the plan and letting people know when they'll get their belongings back. Last question I'd like to ask the two of you briefly before we open it up to the audience is around the question of return to research to campus over the course of the summer. I know the two of you as task force co-chairs have a working group that's focused very specifically on this. And maybe if you don't mind, I could just ask each of you to provide a little bit more detail on what they're considering and how they anticipate rolling that out and moving that forward.
Why don't I get us started then? So as you mentioned, we have a working group, our research continuity working group, which is led by our Vice Provost for Research, Dean Madden. This is one of our many working groups. And that working group is actively exploring how to carefully and intentionally restore research activity on campus, including what practices need to be in place to protect the health and safety of our community. This will be a careful and intentional process and is likely to occur in a staged or phased in fashion. So some of the things that we're doing that sort of my team will be involved in is looking at lab spaces and personnel and devising a ramp up plan that will take into consideration spacing so that we could allow the 6-foot social distancing and perhaps limiting the number of people that are in the space over a day or even a week. And then also having to consider what are the cleaning or disinfecting practices of high touch surfaces. And maybe with that, I'll turn it over to Josh to comment on that piece.
Yeah, I mean, the other key piece that you hit on, Lisa, is, even within the labs, there are then the common spaces in the buildings. And so part of what we're looking at is what are the appropriate standards to put in place for shared spaces like bathrooms or, common touch areas like the exterior doors to buildings. So we're working with facilities teams to think about how do we create the right level of disinfecting and regular cleaning and make sure that we have the staff ready to go. And so it's a lot of coordination. The other piece we're watching closely is to make sure that the appropriate personal protective equipment is available. It's been an issue across the board. It's one that we watch very closely and want to make sure that the levels more broadly are available so that when our researchers are back, that they have available what they need and that we are kind of doing it, being aware of what the needs are for the medical community as well. So a lot of balancing acts that have to happen there to do that well.
Great, thanks, Josh. And I'm pleased that you mentioned restrooms. There is a paper actually that I just saw in draft form this morning in Nature Science. It was a study done in some of the hospitals in Wuhan, China, and they found that one of the areas they needed to be most attentive to, where there was the highest aerosolized viral particle loading, was, not surprisingly, in the restrooms. So let me ask Justin to turn to our audience and see if there are any questions coming in from outside that we can direct to the two of you.
In fact, there are, Joe, so thank you very much. I think this first question probably should go to Josh. It's an interesting one. Has the committee or has the task force at all discussed the possibility of shortening the 6-week winterim break in order to delay fall term and allow it to be conducted on campus. It appears as though a modification of the calendar would allow for more time to prepare for fall term. Is the 6-week break really necessary?
So I would say the task force has examined lots of different permutations as we think about fall. We've spent long hours thinking about the various ways to tackle this. So at this point, I think our priority is to figure out what option allows us to get closest to what we would have called a normal type of operation. And so we'll be watching all of that closely. Lisa, maybe you can comment a little bit more on the timing piece and how we're thinking about how that all impacts our decision making.
No, it's a good question. Certainly a scenario, as Josh mentions, that we have considered. There are pros and cons to almost every permutation that we look at. The delayed start maybe gives us a little bit of more planning time up front, but we really have to think about what we gain in those extra weeks versus having a Thanksgiving break towards the end of the term, for which we know people may very much want to travel during. And that seems like the cost benefit there of having people, again, leave campus, return to campus. Would there be a 14-day self-quarantine period as there is now for people entering the state from elsewhere? It gets very complicated. And so we are looking at what we can do to provide and really preserve and provide the best educational experience in the time frame that we have. So again, we are, so everything's on the table right now as we're trying to keep an open mind about all this, but I do think we are weighing sort of pros and cons to scenarios such as that one.
Thanks, Lisa. And I'm gonna stay with you for this next question. It seems to involve area of expertise. Mm-hmm. If people who are sick are told to just stay home and isolate rather than going to DH to be tested, how accurate do you feel the number of cases is for the Upper Valley?
So we do know that our testing is not as complete as we would like it to be, and that the populations that we've been able to test are it's a small, much smaller cohort than we would like to be able to test, and that testing has been available in other countries. So we know that our results of individuals who have tested positive is a great underestimation of probably the true number of infections that are out there. By what factor? What is that ratio? We don't know exactly. There are some estimates out there, but I think as we have more access to testing for both disease and to indicate past infection, we will be gaining more information about what is the true extent of COVID-19, in our U.S. population.
Thank you for that, Lisa. Josh, I'm going to go back to you. A number of questions have come in about the Hanover Country Club and its status, given the recent announcement that it will be closed for the season. Can you speak a little bit about that decision?
Yeah, I know that's one that there is certainly caused a lot of disappointment for individuals, as many of the decisions that we've made have. So the decision is just about this season at this point, and was part of a larger decision about our summer activities on campus and wanting to reduce the number of people on campus and really limit the operations of what we have this summer. So the decision is about this summer. There have been, we're in the process of issuing refunds for those who had membership fees. And then as we look at the broader picture, we will, as we get to the other side of the COVID crisis, we'll take a look at how we move forward with the golf course.
Thanks, Josh. We We have time for one more question for you guys, and I'll go back to Lisa for this one. It's an interesting question. Will incoming international students be prioritized for starting on campus in the fall? If some groups are allowed to attend, will this include new international students? So this question is about international students specifically, but the issue really is much bigger about, if we go to a hybrid model, how is the campus populated? So I'll go to you for that one.
Yeah, let me make a couple points there. I think everyone knows that we already are housing some students on campus, a small number, less than 200 students, some of whom are international students who were not able to return home. And we will certainly expect to continue to be doing that. In terms of who would be returning to campus if we are able to do that partially residential term for undergraduates starting in the fall, that is very much still under discussion and will certainly be a senior leadership decision. I will say too, just to keep in mind about what fall term might look like for whichever students are returning, that we are still expecting that there will be a requirement around some of the public health measures that are in place now, the social distancing, the frequent hand washing, the use of face coverings, the probably statewide ban on large mass gatherings. We expect those are still going to be in place. So we will be working with to allow the largest number of students that we feel like we can safely welcome back to the campus, but recognize that some of these public health measures, many of them are still likely to be in place. So however students are welcome back, there will be guidance and some of these measures that we will absolutely expect our students to adhere to.
Thank you very much, Lisa, and thank you also, Josh. I appreciate your time and your willingness to engage with Joe and take some of these questions. There are a lot of questions that came in that we couldn't get to. I do encourage folks to check out the Dartmouth COVID-19 website, which you can get to through the homepage. There is a feature there, an email address that you can use to ask questions. We will try to respond to every question that comes in. So if you didn't get your question answered today, please think about taking advantage of that opportunity. And of course, we'll be back next week, and you'll have the ability to ask more questions. So with that, I'm going to go back to Joe.
Great. Thanks, Justin. So Josh, Lisa, let me echo my thanks for all of your great work leading the task force these past 2 months, but also for being part of our conversation today. And so to everyone who's watching, I think you get a sense of the key interrelated, challenging questions we need to address as we think about fall term. How many students can we bring back? We're committed to bringing the maximum number possible back to campus safely and with health and safety first and foremost in our minds. Who are those students who get to come back if not everyone is able to return? What curriculum can we put in front of them, and how will that differ for residential students versus those engaging in remote learning? And then, as Dr. Lisa Adams just said, and what will campus life look like? What kind of restrictions, social distancing, PPE, contact tracing do we need to think about as we anticipate fall term operations? But with all of that, I will say again what I said partway through my remarks this afternoon. Dartmouth will be open this fall. We are not contemplating cancellation of fall term. Fall term will take place, and the challenge for us is to figure out in the next 2 months the appropriate operating model that enables us to bring the maximum number of students safely back to campus. So let me end there. Thank you all again for your interest and attention. We will be back at this time, 3:30 next Wednesday, and I anticipate having as guests 2 members of the Dartmouth College faculty who will speak a bit about their engagement with students and their experience and what they are learning going through for the first time this tremendous remote learning experience at Dartmouth. Thank you, everyone. Look forward to seeing you next Wednesday.